Thanks very much, Chairman. Good afternoon, ladies and gentlemen. My name is Koichi Suda from Keio University. I have been working with Professor Uyama at Fujita Health University, which is the highest volume robotic center in our country. Today, I'm going to talk about what's hot in robotic general surgery in Japan. So, as you know, Da Vinci surgical system is characterized by a couple of features which may overcome the limitations to conventional minimally invasive surgery. In our country, actually the first robotic case was done in 2000, which was robotic cholecystectomy at Keio University Hospital. 9 years after that, Professor Uyama performed the first robotic radical gastrectomy at Fujita Health University. And soon after that, Da Vinci S surgical system was approved by Japanese FDA. And then in 2012, robotic prostatectomy was covered by medical insurance. And in 2015, Da Vinci Xi was sold. And last year, robotic partial nephrectomy was covered by medical insurance system. And actually, for now, there are 237 Da Vinci surgical systems installed in our country, which is the second largest number in the world. However, only 16,000 robotic procedure was performed last year, suggesting that only less than 70 cases per system per year was performed in our country, which is the smallest number in the world. This is largely because the robotic procedures are not covered by medical insurance system. And in terms of robotic general surgery in our country, only about 800 cases were performed annually at limited number of institutions, including Fujita Health University Hospital. This is also largely because robotic procedure in general surgery has not yet been covered by insurance. And actually, patients are charged 20 to 30,000 US dollars, and mostly focused on GI and HPV malignancies, which requires more advanced skills in laparoscopic surgery. And recently, Professor Wakabayashi started robotic hernia repair, but it's still probably approximately 10 cases so far. And actually, over 50% of robotic general surgery procedure were robotic gastrectomy for gastric cancer. Outside of our country, actually, robotic gastrectomy for gastric cancer has been recognized as a questionable effect. There are lots of small retrospective studies, and there are only one multi-institutional prospective large study. And actually, last year, the group of Yonsei University reported the result. And according to their paper, the robotic procedure increased the operative time and cost, and all the other short-term outcomes did not change by using the robot in comparison with conventional laparoscopic approach, suggesting that use of the robot even deteriorated the cost effectiveness of minimally invasive gastrectomy. But actually, in these prior studies, most of the patients are early gastric cancer cases, but not advanced gastric cancer cases. At Fujita Health University, from 2009, the robotic gastrectomy has been applied to operable patients with resectable gastric adenocarcinoma. So, and who agreed to uninsured use of the robot. So, over 40% of robotic cases are advanced gastric cancer. And actually, according to our retrospective analysis, the use of the robot significantly reduced the total complication rate, especially pancreatic fistula. Pancreatic fistula did not occur in robotic gastrectomy, which is really surprising. And as a result, duration of hospital stay was significantly attenuated in robotic cases in comparison with the conventional laparoscopic cases. And long-term outcomes did not change between robotic and laparoscopic groups. So in terms of cost effectiveness, we think that the effects of the robot, including the reduction of mobility and hospital stay following surgery, may balance the additional cost generated by the use of the robot. So now we have been conducting a multi-institutional prospective trial, which is approved by Japanese Ministry of Health, Welfare, and Labor. And actually, in this clinical trial, the patients have clinical stage 1 and 2 gastric cancer. And the primary endpoint is the mortality, Crabbe Dindal grade over 3. And our hypothesis is that the use of the robot may reduce the morbidity from 6.4% in conventional laparoscopic gastrectomy to 3.2% in robotic gastrectomy. And actually, the registration of the patient has been completed, and probably next June, the short-term outcomes will be released. So I can't let you know the exact results for now, but probably, hopefully, next year, the robotic gastrectomy would be covered by National Medical Insurance System. So in conclusion, the greatest advantage of the robotic procedure may be the potential that the use of the robot helps lots of surgeons perform technically demanding operations more easily in a less invasive manner. Medical insurance coverage for robotic surgery, as well as adjustment in the price of the robot, is desirable to provide more patients with the advantages of the robot. Thanks very much for your attention.
Thank you very much for